Joining me now via Zoom internet conference here on Indiana in the Morning is Dr. Richard Neff, the Chief Medical Officer of Indiana Regional Medical Center. Dr. Neff, good to hear from you once again.
Thank you. Good to hear from you.
And I know that things have been going extremely well with the COVID-19 vaccine clinics over at the KCAC, but it's now been a year since the pandemic started, and although we're seeing positive news about the vaccines, how effective they are, we also see a lot of negative news about the distribution of vaccines in Pennsylvania. So as far as vaccine distribution goes, do you feel Indiana County or IRMC, for that matter, is getting its fair share of the supplies of vaccines from the state? And what is your rationale behind that opinion?
There are a couple of things about it. It has been a very rocky rollout for distribution. However, I'm really glad to say there are two things. One, the Commonwealth has gotten to the point where they're able to go ahead and give us a steady vaccine supply and a guarantee for that, which is allowing us to go ahead and schedule out more than just 1 week, which is absolutely fantastic. Additionally, the Commonwealth has selected IRMC as one of the places to go ahead and give added focus to as far as vaccinations. So we should be able to ramp up our vaccination program over the next couple of weeks. So that's been very good news. But it has been very rocky going forward, and a lot of demand, a lot of wish for vaccine, a lot of challenge with that. But I see better days ahead with that.
You mentioned the focused vaccine distribution. How is that going to come into play then? Is that going to be a new age group opening up or going into phase 1B?
We are at this point opening up to the 1A group with medical conditions. So those 16 to 65 with medical conditions, continuing to vaccinate anyone over the age of 65 who wishes to be vaccinated, as well as healthcare workers. But we are opening it up. We are doing it in stages just to try and make sure that our scheduling processes don't become overwhelmed. When we initially opened it up, we had significant wait times that were a very big dissatisfier for all of us around. And so we're trying to make sure that we get people scheduled in a logical pattern that helps everybody out.
So a lot of the people who were on the website and had either long wait times or couldn't get in, they'll now have a chance to get in and register through the IRMC.org website for vaccines.
Correct.
All right.
We are working on a process to develop a self-scheduling system that we hope to have live at some point in the beginning of next week.
So, okay, that's good news to go live starting next week on that. The clinics at the KCAC, we've been hearing about it that if I was to put it in theatrical terms, it would be sold out. It would be sold out shows. So the vaccine clinics at the KCAC it sounds like they're not only running very well, they're running efficiently.
They're running very efficiently. We had our first over 1,000 dose clinic on Friday, and it went largely completely like clockwork, and our team is there looking at it and believing that we can actually do more if we have the vaccine there. So we're planning on expanding the number of doses we're able to deliver in that time frame over there. The KCAC has been a very good spot for us to be able to do this work efficiently.
So the vaccine clinics will continue at the KCAC for the time being then?
Correct.
We have been hearing from the county that they're trying to possibly set up another vaccination site. Have you been privy to that conversation, or is IRMC helping out with that process?
We have been working with the county to go ahead and develop plans for when the Johnson & Johnson vaccine is available, and that will give us much broader availability and possibilities of doing additional sites elsewhere, and also to do home visits and to get vaccine out to people that aren't truly not able to get out of the house or out of their homes.
Now, we should make mention the Johnson & Johnson vaccine is the one-shot vaccine, and from what I understand right now, that is currently open to teachers. They're doing it through various clinics with their respective intermediate units.
Correct.
All right. So it'll be good to get another round of it because we do have 3 vaccine companies, possibly a 4th now coming through with their own. I believe AstraZeneca is trying to put their own vaccine out there.
Yes, and they've been being used in the United Kingdom and elsewhere in the world with very good success, and looking forward to having more options.
We're talking with Dr. Richard Neff about the COVID-19 vaccinations that have been going on in Indiana County. And Dr. Neff, talk about, I saw the total on Saturday and the fact that over 14,000 vaccinations, I believe it was, that were announced. And then we're talking total either first doses or everybody getting their complete doses. So over 14,000 doses handed out by IRMC, and over that total going out over the county as well. That's pretty good speed, it sounds like.
We are becoming better. Our vaccine supply is becoming more sure, and we're getting better at administering it. So it's been a great work with the team that we have here.
Talk about the volunteers that have come through. I know that you had mentioned in one of your first visits to the station that the hospital is looking for volunteers to work with data input and things like that. How have those volunteers been working out?
They've been fantastic. We've had a large crew of people that have been able to help out. Some in the lobby helping to direct people to what the processes are. Some people helping people to usher them through the entire process, and then some with vaccination. We see retirees that have been coming back out to help out with that, and other community members. It's been a great community effort.
All right. And can people still volunteer for that if they feel like they can, if they want to help out?
Yes, I think we're still going to be looking for developing those processes, and we can get that on the website as far as how to do that.
Excellent. And we should mention the website address. I believe it is irmc.org/vaccine. Correct me if I'm wrong.
That's correct.
All right. irmc.org/vaccine. Dr. Neff, this has been a year, and for many people, I would say this has been an exhausting year, going through various protocols. But I guess the best thing we can do now is kind of keep the faith, knowing that the vaccines are going to be coming in and more vaccines are going to be guaranteed to be coming into our area within the next couple of weeks.
There is a bright spot coming. One of the hardest times in a pandemic situation is when things start to be getting better. We're not through this in the least, and still needing to make sure that we help to protect our most vulnerable people in our society here by continuing with the masking, the social distancing, and frequent hand washing. Those are still very important because there are seeing some spikes of some of the variants out there in different parts of the country. I see some increase in Michigan. All that is quite concerning when we still have far less than the 70% immune and protected that we need to get to. So we have a good way to go still, but certainly brighter days forward. And one of the things I'm seeing around and hearing about in town is some of those who have been vaccinated that are elderly, that have been sheltering in their homes, starting to feel like they can come out some and get around and do things. That is a great thing to see.
Mm-hmm. Definitely is encouraging to hear that news. But again, this is something that shouldn't be rushed, as you mentioned. But we are seeing Governor Wolf certainly easing the restrictions, the CDC offering up some new guidelines for people wanting to visit others. So it's, again, all encouraging news. We're going uphill, and it seems that barring anything weird happening, we can continue to go uphill.
Yes.
All right. Dr. Richard Neff, hey, thank you very much for joining us here on Indiana in the Morning to discuss this. All the best to you, and I hope the clinics continue to be a success, and keep us posted.
Thank you, Josh. Have a great day.